watching Morning at NTV.
Morning at NTV, and we're taking Not Still. My name is Priscilla Regina Nalwoga. Thank you so much for having been with us from 6:30. As we come to the top of the hour, we want to look at supporting corrective surgery for children. And of course, the Rotary Club of Muyenga, they've been working on this, and they're working with Cure Hospital in Mbale to provide support for corrective surgery, and this is to children. And to speak to us about this conversation is Mr. Kelechi Azubuike. Good morning to you, Mr. Kelechi.
Good morning, Priscilla.
How are you?
I'm fine, thank you.
Please remind us of the four-way test.
Of the things you think, say, or do, first, is it the truth? Second, is it beneficial to all concerned? Third, will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned?
Okay, clearly all that is broken down into the kind of work that you are doing right now.
Yes.
With the corrective surgery and the Cure Hospital in Mbale. I think we want to first understand what exactly are those particular corrective surgeries that you're working on with this hospital.
Okay, particularly our club got involved in the area of hydrocephalus and spina bifida. Hydrocephalus is a condition where you have water retention in the brain. Okay. And spina bifida is about children that are born with spinal cord defects.
Okay, yeah. All right. And how many children are you currently supporting with this project?
Yeah, in this project, we started yesterday and we run till the 1st of April. We're going to perform free surgeries to about 50 indigent children.
Okay. And how does a parent get to enroll their child in case they have some of these corrective surgery needs?
Okay, unlike when we first started, where we had to look for these children, identify them, and perform the surgeries. Later, when we started dealing with Cure already have a database.
Yes, they do.
Yeah, they already have a database of children that have these ailments. But most of the time, because of the parents are indigent, they cannot afford the cost of the surgery, so you find out that they're on the list for a very long time.
What's the cost of surgery? That's
with what we are doing with Cure, they subsidize, and we pay approximately 900,000 shillings per child.
Per surgery.
Yeah.
Okay, all right. Please continue.
Yeah, so they already have the database. So what we do, they pick from those that are not able to afford the treatment, and then we pay for them and they perform the surgeries. Okay.
And who qualifies for this kind of help? What is the age group that you're looking at right now?
Mostly this affects children. We are not particular about the age group because even adults can actually develop these conditions. But at the moment, we are dealing directly with children. And most of them are always, say, below the age of 7. Yeah. Okay.
All right. So what support as a Rotary Club of Muyenga do you need to actually push this initiative forward to the end?
Rotary Club of Kampala, Muyenga Breeze. Yeah, initially when we started, we were funding from members of the club, but with time we got to have some corporate support. We have a special program through which we fundraise for this program, which we call Cowboy Nights. Yeah, it's a fundraising event specifically for this project. Okay. Yeah, but meanwhile, let me correct you. The name of my club is Rotary Club of Kampala, Muyenga Breeze.
All right, thank you so much, Mr. Kelechi. And we definitely are interested to know, is this going to be a recurring project, an annual project that your club will be looking after, or it's a one-time?
No, this is a signature project of our club. We have been doing this since 2014. When we did the first project.
And how many children have you catered to since 2014?
Between 2014 and now, because when we started in 2014, we did about 13 children. like I told you, the process at that time was very hectic because we have to put up commercials inviting people with such ailments to come to us, and then we do the screening. Now you find out that actually we got overwhelmed because you can find out like you have like 50 children that turn up for a screening on a day, and you end up with only maybe three children that qualify for surgery, because it's not every child that has that ailment that qualify for surgery. So the medical people know how to determine who qualifies or not. Yeah. So in 2014, when we started, we had about 13. So we have progressively increased till then. At that time, we were doing it with Dr. Joel Chirabuire, and we were using Kosu Hospital at the time. Okay. And Kosu Hospital, as you know, is more like a specialist orthopedic hospital. So their theater actually was not designed for this project. Mm-hmm. But how we started is a member of our club, Pastor Peter, has a friend, an Australian, who happens to be a neurosurgeon, Dr. John Christie. So John Christie wanted to use his holiday period to do charity work. So he was looking for what he can do in Africa. So when they contacted me, then I was the president of the Rotary Club of Kampala, Muyenga Breeze, and our club director of projects at the time was a retired Colonel Dr. Godfrey Buire, who is our current president. So when we discussed, he said, okay, we can do this. So we contacted Dr. Joel Chirabuire, and he welcomed the idea, and then we started. So Dr. John Christie used to fly at his cost from Australia to Uganda, stay for about 2 weeks, and they perform all these surgeries, and then he goes back. Okay. So at the time, because Kosi is not suitable for that, for these surgeries, they referred us to Cure. And Cure is a specialist hospital, particularly in hydrocephalus and spina bifida. Okay. Yeah, so we became more confident. Now we had to do away with the process of screening these children because they already have database of those that qualify for the surgery. Yeah, but over time we have performed more than 200 surgeries on children. Yeah.
All right, well done, Mr. Kelechi.
Thank you.
And the Club of Kampala Muyenga. Of course, when you look at the surgical conditions in children, they're most common in eastern Uganda. And the Cure Hospital is actually placed in Mbale, which gives you, a preview of the children development stats in the eastern region of Uganda. So those that never get to qualify for surgery, but then again, have these conditions, is there a post-sensitization program that you carry forward with?
Yeah, actually, because we've been looking at how we'll be able to reach out more children, and next year we are planning to have what in Rotary we call make this a global grants project, where we get funds from the Rotary Foundation to support what we are doing. And what I intend to do is to increase the capacity of Cure Hospital so that they will be able to perform more surgeries on a daily basis. Currently, they perform about 40 surgeries in a week. So we want to increase that capacity and going to train more people to specialize in this area. So when you have the capacity, you'll be able to reach out to more people. And because it's unfortunate, because there are a lot of people out there that need these services, but it's not available to them. So we are doing our best. Of course, as a club, we will not be able to, cover all the people that need the help.
That's true.
Yeah, but we are doing our best, and we hope that there will be other people that will also join to chip in and see that at least, not only that, because like you asked, it's not only about treating these children, because this is a preventable disease. Yeah. So the sensitization of people in the rural area.
And earlier detection, so that they can have better treatment than having to go for surgery at the end of it.
Actually, surgery happens to be the only treatment for this condition. Yeah. But if we'll be able to educate people, I think it will reduce the incidence of hydrocephalus. But unfortunately, because of the environment most of these people live in, you find out that they are not in a position to even prevent this disease, because they live in squalor conditions and they can't help themselves because of their economic conditions. Yeah.
Okay. All right, well, good job that they are doing there. And I do have a nephew that has benefited from your project. So well done, and thank you. Keep soldiering on and ensuring that whatever it is you're doing is impacting the community. Your final parting shots.
Well, my final parting shot will be wherever you find yourself, do whatever you can to help. You know, you may think that the little that you can help is not good enough, but I can assure you, if you can affect one person, that will go a long way. If one can touch one, it will go a long way in releasing our community of this problem. Okay.
Well, it takes one to reach out to one so that we can change the life of one person. And when it comes to corrective surgery, giving disabled children a chance at normal life. Mr. Kelechi, thank you so much for enlightening us about your project, and wish you all the best.
Thank you for hosting me.
Yes.
Yeah, have a nice day.
Morning at NTV does continue. We return with some of your reactions from our social media pages in regards to our conversations today.